Welcome to the video answers for question set 18. Let's go ahead and get started. This first question is about some common buzzwords. Now, buzzwords can be very important for your exam. You can almost breathe a little sigh of relief when you see a buzzword in a question because they're kind of giving away the diagnosis, and then you can focus on whatever feature of that disease the question is actually focusing on, whether it's pathophysiology or treatment or whatever. So know these buzzwords. So the first one here, calf pseudohypertrophy, and that's seen in Duchenne muscular dystrophy. Gower maneuver is also seen in Duchenne muscular dystrophy. That's where the proximal leg muscles are weak. So to get up off the floor, these kids have to sort of use their hands and push themselves up off the floor. They kind of walk their hands up their legs until they're upright. Subluxation of the lenses, that's a feature of Marfan syndrome and also homocystinuria. Cafe au lait spots are seen in neurofibromatosis type 1. And a tuft of hair on the lower back is a feature of spina bifida occulta. Next. A patient comes into the clinic complaining of severe low back pain that radiates down the back of her leg. What's the most likely explanation for her pain? So this is a classic presentation for a herniated intervertebral disc, where the nucleus pulposus protrudes into the vertebral cavity, usually posteriorly, and it's compressing the spinal nerve root. If it compresses the L5 or S1 nerve root, those are components of the sciatic nerve. It's going to cause low back pain that radiates down the back of the leg, and that's sometimes called sciatica. Next. A 59-year-old man with a 50-pack year history of smoking sees you for management of his COPD. What's the clinical definition of chronic bronchitis? So there are two types of COPD. Chronic bronchitis is defined as a productive cough for at least 3 months in at least 2 consecutive years. And the other type of COPD is emphysema, which is characterized by permanent enlargement of alveolar air spaces. And sometimes asthma is lumped in with COPD. I'm sure you know what asthma is. You have chronic airway inflammation and airway hyperresponsiveness, which of course causes airway obstruction. So it is a chronic obstructive pulmonary disease, but when most people say COPD, they either mean emphysema or chronic bronchitis. Next, what type of cell differentiation and maturation takes place at the thymus? So the thymus is the site of T cell differentiation and maturation. So the outer cortex of the thymus contains those immature T cells, and as those cells migrate to the center of the thymus, which is the medulla, they undergo a maturation process. Specifically at the corticomedullary junction, which is the junction between the cortex and the medulla, those T cells undergo a positive and negative selection to make sure the thymus is not generating the wrong T cells. So continuing in the question, the thymus also functions to positively restrict MHC at the corticomedullary junction. On which cells would you expect to find MHC1 and MHC2? So MHC1 is found on most all nucleated cells. MHC2 is expressed only on antigen-presenting cells. Next, in your own words, describe what type 1 error is. So type 1 error, or alpha error, means that your study shows a difference between 2 groups, but in reality there's no difference between the groups. For example, if you did a study to see if taking a daily aspirin would change the color of your toenails, and your results of your study show that, yes indeed, taking an aspirin daily will in fact turn your toenails bright green, that would be a type 1 error because in reality, taking aspirin doesn't change the color of your nails. Next, a 50-year-old woman develops a new onset of lower back pain without a specific injury. Lumbar x-ray reveals lytic lesions which raise suspicion for multiple myeloma. Now, multiple myeloma is a malignant neoplasm of plasma cells that proliferate within the bone marrow, and that's going to release local osteolytic factors that foster the breakdown of bones and cause those lytic lesions that you can see on x-ray. So the question is, what's the characteristic finding on electrophoresis with multiple myeloma? So plasma cells are just mature B cells whose only job is to make a specific antibody. So in electrophoresis, you'll see an M spike, a monoclonal spike of whatever particular immunoglobulin all those neoplastic plasma cells are producing. Now most of the time, it's an IgG, but it could also be an IgA or some other isotype. So what's the classic finding in the urine of a patient with multiple myeloma? These are called Bence-Jones proteins, which are immunoglobulin light chains found in the urine. Now, these are not detected as elevated protein on a regular dipstick urinalysis. Urine protein electrophoresis is required to identify Bence-Jones proteins. Next, a 30-year-old man who's experiencing shortness of breath is diagnosed with obstructive lung disease on pulmonary function testing. The patient does not have a history of asthma, and he's never smoked. Patient subsequently diagnosed with alpha-1 antitrypsin deficiency. How does the emphysema caused by smoking differ from the emphysema caused by alpha-1 antitrypsin deficiency? So alpha-1 antitrypsin is an enzyme produced in the liver that protects the lungs from neutrophil elastase. Elastase is an enzyme that degrades elastin. So alpha-1 antitrypsin inactivates elastase. So when you have a genetic deficiency of alpha-1 antitrypsin, those neutrophils are just doing their job, but they end up destroying the connective tissue in the alveoli, and that leads to pan-acinar emphysema, meaning that the entire acinus is damaged. In contrast to that, smoking causes a centri-acinar emphysema, which means only the central part of the acinus is damaged. So think about alpha-1 antitrypsin deficiency in a patient that's diagnosed with emphysema at a really young age, or emphysema in a non-smoker. Next, what trace element is essential to the function of carbonic anhydrase and lactate dehydrogenase? Well, that's zinc. So zinc is very important for a handful of key biochemical processes, such as certain types of protein folding. If there's no zinc, those proteins won't be able to fold up into the proper three-dimensional conformation. The enzymes won't work. Next, you're performing a radical mastectomy and exercise extreme caution as you dissect laterally along the serratus anterior muscle. You do this in order to avoid severing which motor nerve, which would result in what sequela. So you're trying to avoid cutting the long thoracic nerve, because if you accidentally injured that, you could cause something called winged scapula, which is where the scapula kind of sticks out from the back at a weird angle because that serratus anterior muscle is paralyzed and it can't pull the scapula forward. And our last question, in what clinical scenarios would you see a nutmeg liver? So nutmeg liver is where you have hepatic congestion, so that if you looked at the liver grossly on biopsy, it looks kind of mottled like the texture of a nutmeg. We see nutmeg liver in patients with increased central venous pressure or with increased resistance to portal flow. So this would include right-sided heart failure, classically, and also Budd-Chiari syndrome, which is thrombosis or compression of the hepatic vein. So that's it for question set number 18. We'll see you next time.